In 2013, during the second year of my postdoctoral fellowship at the University of Maryland, my wife, Tali, was diagnosed with breast cancer. At Johns Hopkins Hospital, she received the best medical care for her cancer, a treatment that was proven successful by dozens of similar cases. She had 2 surgeries and was treated with a daily medication. Her treatment included life-changing decisions and harsh side effects. A decision such as if a woman, which was 34 years old, would be able to have any more children. The doctor said that with recommended treatment, the cancer had recurrence chances that are lower than 7%. We are very happy, because who cares if the treatment is not optimal or has side effects, as long as Tali is okay. 2 years later, Tali, myself, and our 2 kids, Noam and Ella, came back to Israel, where I received my faculty position at Ben-Gurion University of the Negev. 6 months later, a routine diagnostic test revealed that the cancer returned. Tali had another surgery, went to chemotherapy and radiation. When the cancer returned, the treatment was changed from one type to another type, plus injections once a month. The treatment was changed because it failed. The cancer returned. This is a conventional treatment that Tali is going through for 10 years long and are extremely suboptimal. They have the side effects of a small dose of chemotherapy, such as neuronal activity damage, sleep problems, and menopause symptoms. This is her daily routine. The important thing that she's okay, and actually, she's here with us in the audience. All this time, I've been asking myself, why? How come a test that's supposed to be accurate was wrong for Tali? Why a test that provides chances for cancer recurrence that are less than 7%? Now, 7% are low chances, right? But when the cancer returned, Tali is 100% sick. We're doing the best we can, but I believe we can do better. What if could be another way to diagnose illnesses, or another way we can find to monitor treatment? To answer these questions, first, let us understand how the diagnosis is currently being done. The diagnosis process is based on trying to personalize the test for each patient by taking the sample from the patient to the lab, there it is being analyzed. For example, in Tali's test, a small biopsy piece from the tumor was taken to a dish, chemicals were added, and the results were compared to statistical data from other tumors. Eventually, these kind of tests are very much inaccurate. Eventually, we try to find ways to improve those kind of tests. When the reason for that it is not accurate is that those tests miss a great deal of the medical information. The sample is extracted from the body before being analyzed, is frozen, stored, transferred to the lab, there it is being thawed, and chemicals are being added. All this preparation caused 2 main problems. One, the composition of the molecules in the sample has changed. And the second one, the time has passed since the sample was extracted from the body. Therefore, the image that the test provides is inaccurate. So how can we diagnose differently? How can we bring the lab to the place where the sample was extracted, to our body? In 1966, there was the American film, The Fantastic Voyage. It tells about a submarine crew that was shrunk to a microscopic size, was ventured through the body of a sick scientist and fixed problems in his brain. People call this movie science fiction. I mean, come on, people go in the body, locate illnesses. Well, this kind of science fiction is already becoming a reality. The Israeli company Given Imaging developed the PillCam capsule that can travel in the body, take images of your intestines, and locate illnesses such as cancer. My science fiction is integrating diagnosis together with treatment into nanodevices that can explore our body, identify cells, and autonomically administer the treatment. It is called precision medicine. My research team is working towards one of the major challenges to enable transforming into precision medicine. We work on a specific technology that enables measuring molecules directly in the body without any preparation. For example, one of our projects focuses on schizophrenia and the burden of the treatment. About 1% of the population is being diagnosed with schizophrenia. And those that are being diagnosed require lifelong treatment with antipsychotics, medications. Now there is this medication called clozapine. And currently it's the best medication available for schizophrenia, with other medications that are not as effective. But 60% of patients stop taking the medication in the first year. The reason for the underutilized clozapine is the burden of monitoring its treatment. In the US, for example, patients that want to take this medication need to go to the physician office, take the blood drawn, the sample is being sent to the lab. In the meantime, the patient goes back home, and then when the results come back, need to go again to the pharmacy, take the prescription. And that has to be done every week for the first 3 months. Current tests to measure clozapine are extremely suboptimal. They're expensive, painful to the patient, and eventually inaccurate. My lab developed a blood test that can be done by the patient by pricking the finger and rapidly measures the clozapine levels in order to provide optimal care. Eventually, our body is working on many, many molecules that continuously change the concentrations. And illness is governed by about 10 to 15 of these molecules. However, current tests are able to measure only a specific part of these molecules, therefore missing a great deal of the medical information. This kind of test provide inaccurate measurements and decrease the effect of our life eventually. Therefore, our group has been working developing intelligent sensors, those nano devices that can taste samples and identify, decide if the patient is ill or not. And by taste, I mean that this kind of innovative sensing technology it mimics the way our tongue is working. We use artificial intelligence to teach our sensors to recognize specific flavors of different illnesses, and for that decide if the patient is ill or not, and decide about the information it has in those samples. For example, actually tasting illnesses is already known back in 600 BC, where it was first recorded that ants were attracted to the sweet in urine, sweet sugar. In the Middle Ages, physicians said that they were diagnosing diabetic patients by actually tasting the sweetness of their urine. In 1674, the physician Thomas Wheeler described the diabetic urine as wonderfully sweet, as if it were imbued with honey or sugar. So our technology, our sensor, are able actually to adapt themselves per patients by taking those artificial intelligence and tailoring that towards specific patient by their standard levels. So eventually, I believe that this kind of vision can be a reality by working together with scientists from fields in computer science, engineering, medicine, and life sciences. Eventually, we can have this kind of nanosensors, for example, in Tali's case, to explore the body, detect specific cells, specific cancer cells, administer a variety of medications, and identify the most optimal one. We can use also the nano devices to monitor the way, to monitor the effect of blood pressure and the related medication, and to autonomically administrate optimal levels. The Fantastic Voyage was a science fiction movie 60 years ago. Imagine for yourself, what could be our science fiction in 60 years from now? Thank you.